Today I checked, the AQI in Delhi was close to 400. I also read a report that at least in October, we had the worst October in the last 3 years. हम किस current स्थिति में हैं अभी?
This type of a level of pollution is quite damaging for the lungs. So the lung heart machine will start gradually getting affected.
You are actually breathing a very toxic air where patient feels choking sensation in the chest, difficult to breathe, difficult to stand out.
Everyone is complaining of same irritation in the throat, eye irritation, and they are feeling some kind of headache, heaviness when we take the BP. Basically, this pollution is an long-term inflammatory stimulus.
There are very wonderful acupuncture points which are located in our chest wall, in the back of our next to the spine, which are points which are very useful to build up the immune system.
1000 mg of vitamin C, only one amla.
What can we do at home to make sure we don't have to go through the pain of this health emergency we are in? Welcome everyone to this special initiative of Beyond Billables. We are in the midst of a public health emergency. And today, for those of all of you who are watching us, we are gathered today with a very special panel. On one hand, we have Dr. Raman Kapur, who's an acupuncture specialist. We have Dr. Bobby Bhalotra, who deals with respiratory medicine. And we have Dr. Dua, who specializes in homeopathy. Thank you all for coming here and for contributing in this special initiative of making people aware of what kind of public health emergency we are in. अब मैं ज़्यादा टाइम मैं खुद नहीं लेना चाहूँगा. I just want to ask one question and I leave it to all of you, sir, कि आप इसको कैसे ले जाएंगे. Today I checked, the AQI in Delhi was close to 400. I also read a report that at least in October, we had the worst October in the last 3 years in terms of air pollution. And a lot of AIMS doctors have also classified this to be a public health emergency. So I will request maybe Dr. Kapur to help us understand हम किस current स्थिति में हैं अभी.
Thanks, Rohan, for taking the initiative. So if I start off, basically, I feel that definitely it is in a medical emergency and we have been reading about it for a long time. But I think there have been different contributing factors which I think have been responsible for this pollution coming up at this particular time of the year every year. There have been reports in the media and we have been reading all about it, and all of us have been suffering. Ourselves also, our family members also have suffered. We also tend to have these recurrent sore throat feeling, but probably because our immune system is better, we are able to come out of it. But then we see people all around of us suffering, and small children particularly, I find, even my own grandchildren, we try to keep them indoors, which is not a very good idea, you see, because at the end of the day, if we remember our childhood, we were never restricted by our parents to not go out of the house. But now we are restricting our grandchildren. And that is not a good idea, because at the end of the day, they need to build up their immunity, their resistance also. So an AQI of 400 or 500 is actually not at all good, because as Dr. Bobby will agree with me, this type of a level of pollution is quite damaging for the lungs. And then, as we all know very well, that the lungs are connected to the heart machine also. So the lung heart machine will start gradually getting affected. And then finally we also know that the neurological effects of this pollution is also very high. So I think I will request Dr. Bobby to elucidate in more detail about what he feels about this level of pollution now.
Such a high level of pollution where you are actually breathing a very toxic air, and now we classify it as a health emergency today. We say it is an emergency. You
Hmm.
have to do certain things, certain measures, so that this emergency doesn't affect the population and the common man. While, as you know, so much pollution in the air, and this pollution is directly going with each breath into the body. It is coming in contact with your skin, causing irritation, eyes causing watery eyes, red eyes. It is getting absorbed in the bloodstream through the lungs.
Hmm.
When it goes into the lungs, these various chemicals, which are highly hazardous, they are fumes from various sources, dust particles. They are going directly into the lung surface, causing inflammation. On short term, they are causing an inflammatory response where patient feels choking sensation in the chest, difficult to breathe, difficult to stand out. When it gets absorbed into the system, people are facing emergency shooting above blood pressures, foggy
Hmm.
brains, coughing, choking. So this is an emergency where the life is in danger. So we are inhaling by force highly polluted air, and it is our right. I think with this YouTube media, we are actually pleading for our right to breathe, which is a fundamental right to exist in this world. So
Right.
these pollutants, they are not only affecting the lung surfaces and causing constriction, swelling in the lungs, causing various symptoms, but also they are traveling down the bloodstream, affecting your cardiac muscles. These are all short term things I am talking about.
Hmm.
And we all know the long term effect. People who have been smoking, the results of smoking come after 20 years. When the lungs are permanently damaged, when the lungs they grow tumors, and then there is no going back.
Hmm.
So to a smoker you can blame that why did you smoke? But where will a Delhiite go when he is just pushed into this circumstance by themselves? Humans are creating this pollution, and humans are the sufferers, and they are not understanding this. It is very important for everybody in the society to come forward, understand the damaging effects of this pollution, and then reduce the levels to a livable level. So, through this YouTube discussion, my aim is to make everybody aware that don't
Hmm.
take it easy. It is going to have a very, very bad long term effect on everybody's health.
Hmm. Dr. Bhalotra, I wanted to understand आपसे that there are reports saying that for people who don't smoke, it's equivalent to smoking a full packet of cigarettes a day. I just wanted to check with you, are reports like this somewhat true? And does it have the disadvantages or ill effects of smoking a cigarette?
Now, what is in the cigarette? So, in the cigarette, you have burned something which, in addition to the nicotine which it has, the nicotine is a dopamine releaser in the brain, which causes cigarette addiction. In addition to the nicotine release, it has got so many chemicals which are getting burned and getting released, and you are inhaling it. And the long term side effect everybody knows is damage to the lungs.
Hmm.
But when you are in the polluted air, when the AQI is 300, 400, which is beyond any acceptable limit, you are also inhaling those bad hazardous chemicals, and they are going into your system. They are damaging equally badly as a
Hmm.
smoker will damage his lungs deliberately. But here You are forced to breathe the same air, because we have created this kind of air around us.
Hmm. Thank you, Dr. Bhalotra, for giving up this insight. I wanted to move to Dr. Dua as well and ask him that there are maybe short-term effects all of us are feeling. Are you seeing a rise in patients complaining about health problems, respiratory problems? And if so, किस तरीके की जनता आपके पास आ रही है? Like toddlers, senior citizens, or middle-aged people as well?
All kind of ages thing. Toddlers, infants, adults, and old age people also. And everyone is complaining of same irritation in the throat, eye irritation, and they are feeling some kind of headache, heaviness when we take the BP. Basically, this pollution is an long-term inflammatory stimulus that may lead actually to that may worsen asthma, COPD, all cardiac disease. Well, the people are not realizing. The public is not realizing. Government is not realizing. Everybody says, "Ji, stubble burning, वहाँ पे हो रहा है जी, this Punjab." That's why.
Punjab.
But why the AQI in Punjab or Chandigarh is 150? In Patiala, it was 140 or something like this. I asked someone. So if that, this is not only the stubble burning, we have to take it as a national emergency. As Dr. Bhalotra said, the government has to take it as a national emergency. The people have to take, like, we are not doing any carpooling. The same
Hmm.
function, three people are going, all are going in a different car. That's not done. We all have to work for this. And I'm surprised the small children, even I've seen the infants. You won't believe it.
Hmm.
4 months of infant, they are having cough, cold, this, and they took them out for just 1 hour or something like that. How the small child can bear all this kind of thing?
And Dr. Dua, short term तो आपने बता दिया for a small child. What would be the long term effect that a small child or a senior citizen would experience if they
Sir,
were to live in Delhi at like 4, 5 years?
sir, ultimately, they will be in chronic asthma cases, they will be in cardiac cases, they can even get stroke. This is a very slow inflammatory process which is happening in your system. Even we are feeling sometimes the dizziness. Like I used to go for the walks and other thing. I've stopped going out. And I should advise everyone to use only N95 or N99 mask. That can only filter this 2.5 pm, nothing, no other masses. No other mask is efficient enough, even three-layer mask and what people are wearing, cotton mask or so, is not done. Only N95 can protect you if you want to go out. But you feel suffocated when you go out with a mask also. For how long you can wear it? In all the clinics, we are just getting 50% of the acute cases are like this cough, cold, and irritation, no fever. They're just
Hmm.
feeling some restlessness, wheezing, and other thing, Dr. Bhalotra. They certainly see more cases like people rush to the allopathic for this. And they are using the inhalers and nebulizers and other things. So
Hmm.
it's actually a national emergency. We all have to work. The government has to work. Side
Thank.
tracks, they should do the all the cementing and other thing. The construction work, they should be closed. In
We'll
the
talk also about the solutions, Dr. Dua, and the long term effects. Just very briefly, with going back to Dr. Bhalotra before I ask Mr. Kapoor's view as well. Dr. Bhalotra, what are the findings that Dr. Dua also saying? Is it similar at the respiratory
Yeah,
ward as well?
respiratory absolutely. He is a famous doctor, and absolutely, he must be having a lot of patients suffering from dry throat, irritating throat, coughing, chest congestion, wheezing. So obviously, pollution is causing a lot of irritation and inflammation in the lungs, and that is also getting beyond lungs through the bloodstream into the other organ. Surely, yes, same symptoms, obviously.
Mm. And Dr. Kapoor, I know we've spoken about sympathetic and parasympathetic, and your work tries to really heal the nervous system. What are you seeing these days?
See, as I put it rightly, and Dr. Bobby will probably elucidate better. You see, most of the times, what happens is that most of the acute patients, because being an allopath myself, most of the acute patients will almost always land up in the hospital setup. So Dr. Bobby can actually give us a bit of figures also on this in the last 3 to 4 weeks as to whether the hospital admissions for in the emergency room as well as in the wards for COPD patients, for patients of chronic bronchial asthma, bronchitis, sinusitis, and hypertension, has that figure really been going up exponentially?
So, absolutely, the number of elderly which are coming to emergencies for admission, and the people who suffer from chronic asthma and disease called COPD, that is chronic obstructive pulmonary disease,
Mm.
or interstitial lung disease for that matter. These kind of people who are chronically suffering from, say, for example, patient taking TB treatment. So when these people they get exposed to the pollution, the impact of pollution is 10 times more on them. So these people are restricted mostly to their homes. They are scared going out. And if they happen to go out during a family get together, marriage, or something, they really suffer because they are exposed to the pollution and their
Mm.
symptoms increase, and then they have to rush to the emergencies. And the most important thing is that despite usual medicines, common medicines, the doctor is giving much more medicine because simple medicines are not working. Because
Mm.
again, the patient goes back in the same air, inhales the same air, and the symptoms, how will they resolve? If you are not giving rest to your lungs, how will the medicines work? So, we have to do something to reduce the pollution levels.
Mm. And Dr. Dua, are you also finding that the medicines in homeopathy, are they having some effect? Are they helping the patient briefly, and then is it going back to normal levels for them?
So, of course, like I would suggest nowadays, this cold weather and little dryness also, and sometimes the moist. One of the best medicine I've seen is the aconite. One should take one dose a day. For the children, I should advise 30 potency, and for adults, it should be aconite 200 C. If you take,
Aconite.
yeah, one dose every day, that will protect you from the recurrence of these things. And one biochemic medicine like ferrum 6X and natrum sulf 6X, that's also very helpful. But once you get the wheezing and other complication like sneezing and irritation in the throat or so, once you get the symptom, then according to the symptom, we give different medicines. Then either they have to see the doctor, whether the wheezing is there or not, whether the cough aggravates at night while lying down, or whether the cough aggravates in the morning, like the dry cough or rattling cough.
Mm.
According to that, we it's an individualized medicine, homeopathic is based on that. So we prescribe accordingly, and they are getting relief. Even with due respect to allopathic or so, people come to us taking antibiotic course and anti-allergic and other thing, but their cough is not going. And certainly we give some medicines, and their cough vanishes in 4 5 days time.
Mm.
So,
Rohan,
And my
actually, this brings us to the point of immunity, where I
yes.
think all the panelists will agree. That basically it's the low immune system. So, like we all know, small children, their lungs are still developing. The elderly citizens, where the lungs are already aged out, so there is a deterioration in their lung
Hmm.
capacity.
Hmm.
And then the patients who are already chronic asthmatics, chronic bronchitic patient, chronic pharyngitis, chronic laryngitis. So all these people who are developing these problems, they are basically their immune system is low. So I think that all of us, whether we as my colleague Dr. Bobby is there, Dr. Dua is there, all of us should be really working more at the immune system level. And if you are going to the root cause, and the root is the immunity, unless and until we start working, because other than that, whatever we do is symptomatic treatment. Like Dr. Bobby is rightly saying, if a patient gets infection, he's got getting green and yellow colored phlegm, infection is already set in, you need to use
Hmm.
antibiotics. There are, if the bacteria has already entered there, if it's a viral infection, perfectly all right, we should avoid. But once the bacterial infection sets in, then we don't have too many alternatives, because the immune system then really goes down very fast. So
Hmm.
at the root of the all this is the immune system. So, where I come into play, and where I have found with my experience of 43 years of my practice as acupuncture, is that there are very wonderful acupuncture points which are located in our chest wall, in the back of our
Hmm.
next to the spine, which are points which are very, very useful to build up the immune system. And we have, and these are random control trials on PubMed, which is available now, which
Hmm.
scientifically shows that whenever we do blood tests in such patients who are coming to us for, chronic pollution related issues, we find in their blood cells that mostly the neutrophils are the blood cells which are going up, and the lymphocytes are the blood cells which are going down. The blood count of lymphocytes is going down. Now, lymphocytes, as all of us know, are the cells which build our immunity. So, if the lymphocyte count is going down, it is an indicator that our immune system is really going down. So, we have shown through PubMed studies that if we needle specific acupuncture points in the body, we can increase the lymphocyte count. So there is
Hmm.
scientific evidence to this fact, and this is all actually now so much well, authenticated by WHO also, which has accepted acupuncture as an independent system of healthcare. Even the government
Hmm.
of India has now
Hmm.
very recently accepted independent system to acupuncture. So I think what is most important to understand here is that we need to build up on the immune system. And we can always take the opinion of Dr. Bobby as well as Dr. Dua in how, what do they feel is a best way to go forward as the immune system is being getting compromised.
Yeah, and one question I think I had for Dr. Kapoor. Dr. Kapoor, is it possible to increase the immunity levels for not just toddlers but also senior citizens?
Very much. So basically, the points are the same, the acupuncture points which we use, and the methods of treatment at these points can vary, because there are children who will not take needles. So what we do in such children is we use lasers. So there are
Hmm.
soft lasers now available which penetrate to the same depth as a needle would, and it is able to give the same effect. So in children we can use that. Even in senior citizens we can use lasers. And then there is something which is known as moxibustion. Now this is a herb which is Artemisia vulgaris is the botanical name. So if we burn this herb at specific acupuncture points and give heat at that point, these are also known to have very strong immune enhancing effects.
Hmm. Thank you so much, Dr. Kapoor. Dr. Dua, I just wanted to come back to you and ask you also. Let's say people who are watching us, we have to create some kind of internal framework for them in terms of what medicines they should have with them at home. At what symptomatic level should they come and pick up the phone and call a doctor or visit the doctor, just so that people have clarity and what should be their like action steps?
Basically, first of all, I always advise कि better to have the daily things what we are having in our kitchen. Turmeric, Ginger is very, very effective. If they take little turmeric and ginger and little honey mixed with that, that can also prevent from this pollution. And jaggery. Jaggery, I've seen if you come back from any of the outing also, have little jaggery and rather saline wash, nasal saline wash as well as the gargling with the saline lukewarm water. Whenever you
Mm,
come back, you please do your nasal saline. आप saline water कुछ भी ले लीजिए. Just wash your nose as well as do some gargles, 3 4 gargles with that. At least some of the dust which are just accumulated in your system, it can come out. And secondly, rest. And I've seen how the immune level goes down when you are mentally not well, when you are in stress and anxiety, that also leads to the breakdown
mm, mm,
of your immunity. Basically, how homeopathic work, we take the emotional level of the patient, physical level of the patient, and mental level of the patient. What they're thinking, how they are considering their disease. Some people are so anticipatory, saying, "Ji, oh, ye ho gaya. So I'm going to have my this lung problem, this and this." So anticipation aggravates your problem.
mm,
So we work on that. We give the medicine, and their immune level increases. So that is Dr. Raman Kapur also said, immunity is the thumb rule. Those
mm,
who are having a good immune level, they can fight with this even pollution and other thing. But most of the people, their immunity is very low. Maybe because of the stress, strain, or the
mm,
the way we are living nowadays.
More sedentary lifestyle, post-COVID, maybe.
Post COVID, and we are not taking sufficient good amount of food. We should be taking more, like to increase your immunity, have more antioxidant, have more juicy fruit, at least your vitamin C can go. One
Mm,
amla can give you vitamin C equivalent to 500 or 1000 mg of vitamin C. Only one amla. So why not to take that every day?
So
That
you're
is,
saying turmeric, ginger, honey, jaggery after coming back from a visit, uh,
yeah, Jack.
amla, nasal saline, as well as gargling, all this will help.
Certainly, it helps. It can prevent you for recurrence of the bronchitis and pharyngitis and sinusitis and other things.
Mm,
That is the best way of doing it. First is the prevention. When you go out, please use a mask. Face mask you have to use. Prevention is better than treatment or that we are going to cure it or so.
yes, our teachers, our parents, our doctors in India have always said prevention is better than cure. Dr. Bhalotra as well. Any thoughts on what can we do at home to make sure we don't have to go through the pain of this health emergency we are in?
I will take this opportunity to guide the listeners that
Please.
what are the danger signs. We have had a good discussion regarding how we can prevent pollution from rising and the preventive methods. But what are the dangerous signs which a patient who has COPD or asthma suffers from? And when he finds these signs, he has to immediately rush to an emergency without wasting time. So, the first sign is blue colored lips. If you find that the elderly in the home is having blue lips, blue fingertips, sign
Mm,
number one. If the person is unable to complete sentences, he's stopping to take a breath and then go forward. If a person is having tachycardia, meaning the pulse rate is exceeding 120, you know, and high fever, fifth sign is chest pain. Patient is unable to stand. Immediately call an ambulance and take that patient to the nearest hospital. It is not needed to take the patient to the hospital where your primary physician works. Take him in an ambulance to the near hospital. This is,
Hmm.
such an emergency where the life is in danger. So, by way of this platform, I am conveying to all the patients who are listening to this that do not ignore these signs. If you have a pulse oximeter at home and the saturation is going below 92, immediately, you know, ask for help. Be ready to reach the hospital. Otherwise, the life can be in a, difficult situation. The most important thing is yourself. Everybody should start contributing that how can I prevent from my side, how can I contribute in prevention of this pollution? Can I drive less if I'm not supposed to be going somewhere? Can I avoid using crackers for the fun of it?
Hmm.
Can I do something? Can I plant some trees in my vicinity? Can I sprinkle some water where I feel that in front of my house there is a lot of dust happening? Can I pour some water, sprinkle some water so that the dust? Why do we have to blame government all the time and sit back home quietly?
Correct.
The saddest thing is that millions of people are just trying to blame the government for pollution. Government is making policies, but who is polluting? Everybody is contributing to
Yeah.
the pollution. It is shameful that we are not doing anything, but we want government to, rectify it. How can they do it? We are spreading the filth all over the place. And you want somebody who we have elected to start, cleaning that area. How can that is possible? It is impossible. You have to stop doing, you have to check that your cars are not polluting. You are not using your cars and other equipments which are not tuned. These are most important things for everybody to understand.
So we are saying, Dr. Bhalotra, that government's responsibility is there, but even Delhiites have to do their own part.
Yes. If a student is not studying, how can a teacher, the best of the teachers, cannot, make him a good, get him good marks? Because
Yeah.
he is not contributing. We are not contributing at all. What are we doing? For us, it is a pain to get the, car pollution certificate. We are even,
Hmm.
we want to give it some money and get one year's certificate. So this is the kind of mentality we are having, and we want pure air all around us. We are cutting trees to make our houses bigger, but we are not planting any tree. So we have to be changing if we want our next generation to be free from cancers, if we want that the next generation doesn't blame us for the mistakes which we are doing every day. We have to improve immediately. It's an emergency not only for government, it is an emergency for every individual. I think with this, I would say that everybody, please wake up. Please wake up, stop polluting, and think of what you can do to reduce the pollution in the longer run. Please.
Thank you so much, Dr. Bhalotra. Let me also take some concluding remarks from Dr. Kapoor and Dr. Du as well. Dr. Kapoor, any thoughts on what long-term habits we people in Delhi, or not just Delhi in India, we can build to make
Dr.
sure the
Bobby has
pollution
summed
levels?
it up very beautifully, and I fully agree with him, point by point, that we have to make our own contribution also. We also have to be understanding that what is our role as a citizen. I think he is very correct that Indians, by and large, Indians are known to keep their inside very clean. You go to any Indian house, Indian household, the inside is very clean. We will see to it that our inside is cleaned up very well every day, twice a day actually. Sometimes we get dusting done, everything done, but the outside is where the problem lies. So he's very correct that planting of the trees, keeping the place around us clean, not even small things like even cleaning of a car, that we are every day we are seeing that people are wasting water on cleaning the car also in the open. So such things, where we find there is, we can prevent it, and excess dust flying everywhere here and there. And as Dr. Bobby rightly put it, that if we self impose certain things, and I think I have, like all of us, we've traveled globally everywhere. uh, I have found that this type of a thing, of self restriction, I have seen most in the Japanese and Singaporeans. I don't know why is it so, but it is quite surprising to see that Japanese are one of those people who are very very strict about their habits, and they take a lot of keen interest to see to it that they do not use vehicles too often. So even in spite of the fact that a lot of Japanese can easily afford a vehicle, I'll still find them using the metros. And we have one of the best networks in Delhi NCR of metro. I don't think there could be a better network than what we have today. Probably we need to increase the size of the trains now, add more buggies to it, because the number of people using metros is already escalating a lot, and we find very overcrowded metros. But
Very
I
packed.
really feel that end of the day, things like this, wherein we as social responsibilities, we also try and understand that Dr. Bobby was correctly saying that if it is not essential, and if sometimes we feel that we can pool a car, we should try and do that. And only essential services, like even my own son, who's a medical doctor, and he also practices acupuncture with me. So he has to go to Gangaram Hospital in the evenings for his OPD. So he doesn't
Hmm.
take the car. So from his Greater Kailash clinic, he'll go to the Kailash Colony metro station, take a metro from there to Gangaram, straight metro, and from there on his way back home also to Noida where we live, he takes a metro. And he says it's quite comfortable. It's not at all a problem. So I think somewhere down the line, the change has to come from within. We don't have to be pushed every time if we are all
Hmm.
people. And then we talk of uneducated. I think the literacy rate even in Singapore, in a country like Singapore, is not very high. So then don't blame it on literacy, because even illiterate people understand this. If they can understand it, why can't we also change our habits? Every time we just blame it, no, no, it's illiteracy which is the reason. No, it is not that. Even illiterate people understand these simple things of life, and even they can take steps forward. Now, even the Supreme Court has been talking a lot about this subject, but hardly we are getting solutions. Why? Because they say that we are only makers of rule. We can't push people. We can't push governments. So governments have to adopt on things they can adopt on. Like recently, all of us remember there was a blanket ban on diesel vehicles over 10 years. But again,
Yeah.
we again cater to the public, and we again change that standard to say now, okay, we will give a laxity for 15 years. So this is not going to help. We need to be more stricter with our rules and regulations. The policing has to be much more effective. We need to see to it that the pollution checks of vehicles is done very regularly by the police. And if we impose heavy fines, I'm sure that is the only deterrent. Otherwise, this is very difficult for a situation like what we are in. I thank
This
you
is
very
close.
much, sir, for
Thank
having
you. Thank you, Dr.
got
Kapur.
us connected. Yeah.
Yes, this is a hybrid of the China model and our activation of our own internal spirit. Just last remarks from Dr. Dua. Dr. Dua, what are your thoughts on bringing about a long-term change about this?
I
Because,
think I
yeah,
think every policy, workplace, and household must treat it with the urgency of health emergency. It deserves that. Without that, we cannot do it. We all have to contribute. Like we should use the EV vehicle. Better to go nearby walking. Why to take your vehicle? Why to and if somewhere we are going, three four people from the same locality or thing, why not to have a carpool instead of three four cars? Only one car should go. And I am very happy to learn about Dr. Raman Kapur that his son is using the metro also. Unfortunately, no metro goes from Vasantwar side where my practice is. Otherwise, I would have also gone like that. So we all have to do it. And the construction, all this dirt lying on the roads and with little air, it's flying. All the dust, cement is flying. They should be strict with the construction. That when you go to Singapore, some building is constructed, nobody knows, and it's just totally covered. And all of a sudden, the multi-story building comes up. How?
Correct.
Why can't we do it in India or especially in Delhi? And I don't understand. Delhi winds are like that. I think winds are flowing like that. From everywhere we are getting the pollution, and the
Hmm.
AQI increases in Delhi only. Why not to in other states? Even I
Hmm.
learned that Haridwar is having a very 100 something AQI. But how the Bangalore has got lots of vehicles and their AQI is hardly 60, 70.
You're right. You're right.
How come that? That was my question mark. If we are just thinking that only the vehicles are causing this pollution, so why not the pollution over there?
Is it possible, Dr. Bobby, as Dr. Dua is saying, that is it possible that one of the major reasons for the pollution which happens during this particular month in Delhi, is it possible that it is mostly being caused because of the wind direction which is flowing, and then because the wind slows down, then these pollutants come down, and that probably is leading to what we are facing, and it is not vehicular pollution, because this is something which I actually also feel quite confused as to why Bangalore, which was one of my patients had come to me from Bangalore, and she was telling me it's 60 70, whereas the vehicular pressure in Bangalore is absolutely bad, even worse than Delhi,
Hmm.
because Delhi is round, so we at least have another way to go, but Bangalore and Bombay are all straight cities, so if you are on a road and if you are stuck there, you can be stuck for hours together.
Correct. And just for
The
context also, Doctor.
vehicles, they remain, the density of vehicle remain same throughout the air in Delhi also. Obviously, it is the sudden change in the temperature, winds, the pressures, which are keeping the pollutants not going away from the city.
Hmm.
Whereas in Bangalore, the rains are also helping to dissipate the pollution levels. So if you have something which can bring the pollution levels from sky to the ground, that is rain. So rain is very helpful.
Dr. Bobby, do you feel artificial rain could be a solution? Because I don't know why we have not been
Artificial
able
rain,
to succeed.
yeah, they are doing it, and I have read that artificial rain has been a success in places like Dubai and
Even
South
China,
Korea
even China
and
as well.
China. But I think we are also learning the technique, and day will come when this technique will be mastered, and the artificial rain will definitely help. So whenever the pollution level like these 400, 450, on those days, if we, you know, get artificial rain, they will immediately drop. So I think in next future, artificial rain is really promising, and we hope that it will work next time.
Hmm. And maybe one question to all the panelists which I've come across is there's a recent product that people talk about. It's a purifier portable which we can wear around the neck. It releases some negative ions. And the study says that negative ions, when they attached with PM matter, it makes it heavy and then it drops on the ground. So the air around our face becomes clean. So, are there any thoughts or any findings on whether this technology works, like as an alternative to cloud seeding, maybe if we introduce negative ions in the atmosphere?
The negative ion, positive ions are there. And if you go to a forest, suddenly the air becomes very cleaner. From a
Correct.
highway, if you enter forest just 10 to 15 meters maybe, and you find that the sudden air quality improves. And if you put any, dead animal in the forest, it decays. The smell out of that dead, dying animal is dissipated in the atmosphere. Why? Because these negative and positive ions, that they are taking care of the bad smell which is coming out. So the pollutants, when they come in contact with these ions, they definitely, you know, their level comes, and that's it. That is the basis for many air purifiers, which are
Mm,
ionizers also. They are actively generating ions which are controlling the, by attaching to the pollutants, they are negating their effect. There is a definite technology, but as far as I understand, that with every breath we are inhaling air at the speed of around 30 liters per minute, which is a very high speed. So, how can a small machine purify so much air around us so that we can take a breath full of those beautiful air particles? So, maybe this technology is there. I'm not very well versed with it, but just looking at it, I'm a little surprised that maybe it is working, maybe it is not. Nobody can tell because you're not counting any ions which are going into the lungs. Theory seems good. Maybe the
mm,
practical also is there, but I have no understanding of the concept that because we are inhaling a lot of air inside, and that small thing, how much air can it purify around us? Because we are inhaling volumes of air, and that can it purify 100 liters of air around us in moments of time? Because 30 liters per minute is a very huge amount of air which
yeah,
we are, that is
that's
in quiet state. When you are running, you are inhaling 70 to 80 liters per minute. So that is something I have to understand more before
Have
I
mm,
you had
start
any
prescribing
experience,
and
Dr.
using.
Bobby? Any of your patients or has told you about using this device? I have not had
I've
any
seen, I have seen people with this, but
long-term
I'm
effects.
still, I have to work on it. I have to learn
mm.
more about this device to understand whether it is working or not.
And Rohan, is it an expensive device? What is
No, it's a device prepared by IITians, IIT Kharagpur,
okay?
and it's been commercialized. I've just ordered it. Apparently, there is a very high demand of it. It's
Okay.
taking a lot of time. I've ordered it for my brother and myself. Let me see how it feels like. But whatever reviews I
Is
could
it
find
cost-wise?
online,
Is it quite reasonable price?
yes, it's about three and a half thousand.
That's not that bad because we really find a lot of children. I find school going children, they suffer a lot from bronchitis and asthma. Bobby knows very well. So, if it is, and a lot of parents would probably be able to afford that type of a device. If it is really that successful, I think it could be a short-term measure, which to prevent particularly acute attacks of asthma and bronchitis happening. But I think
Mm.
thank you for all your
Thank you,
endeavors,
sir.
and
Thank you.
it has
Just wanted to
been
take a moment to thank all of you. Thank you, Dr. Kapoor. Thank you, Dr. Bhalotra. Thank you, Dr. Dua. This session
Thank you.
could not have been possible without all your support and sharing your knowledge. And just to summarize it for everyone, I think everyone who's going to watch this, the message for all of us is while the government should do their job, and we would like that, but at the same time, the responsibility of improving the air conditions starts at home by every Delhiite by taking whatever non-negotiable steps they can do to make sure we live in a clean and a healthy environment.
Thank you.
Thank you all. Thank you once again.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you. Have a good evening, everyone.
Thank you.
Thank you.